Evening and welcome to the June 25th Littleton Board of Health meeting. Tonight we are joined by myself, Kevin Davis, the chair, Matt Wyson, the vice chair, Dan Kane, Francis, Kevin Baker, and Jim Gareffi. All right, let's start with our 7 p.m. hearing about 92 Foster Street. I believe it's Mr. Kirk Fitzpatrick that we need to promote. And is there anybody else in the audience that we need to promote? So raise your hands.
Good evening. I'm Kirk Fitzpatrick with Civil Solutions, and I'm here on behalf of the homeowners at 92 Foster Street.
Awesome. Thank you so much. If you wouldn't mind, if you have something to display and share with the group, that'd be really awesome to do.
Happy to share the plan.
Thank you.
So basically what we have proposed before you is an upgrade for the existing 3-bedroom house. The house is being sold. They had an unofficial inspection and was told it would not pass the Title V inspection. It currently has a small round tank off the left rear corner of the house and some type of a leaching system behind the house. So we went out and conducted some soils testing behind the old system, and we did test holes 1 and 2, where we had about 24 inches of fill over an old subsoil over a sandy loam. We had a water table, observed water table at 78 inches, and a seasonal high water table varied from 42 to 48 inches. Because we did have a water table, we actually used the percolation rate on record, which was 17 minutes an inch, which seemed indicative of the soil. There's not application rate for 17 minutes in the codes would actually jump to 20 minutes an inch. So what we're proposing to do is to come out the back of the house to a new 1,500-gallon 2-compartment septic tank, and that's going to feed a system composed of the Presby and Barrow septic that's 13.5 feet wide by 32 feet long. With the use of the Presby, we're asking for a reduction in the groundwater offset from 4 feet to 2 feet, and this allows us to make it by gravity. The plumbing currently comes out under the floor of the garage, right in the back corner of the garage, so it's under the floor. It would be very difficult to change it. So this allows us to make it by gravity, and it also prevents the fill from going within 10 feet of a lot line. And I'd be happy to answer any questions the board may have.
Before we get to questions, why don't we have Jim and Francis provide any comments that they may need?
Sure. So I witnessed the soil testing out there. Again, small lot, trying to keep the fill that is necessary for the leaching area on the lot. So the reduction helps to maintain the fill within the lot lines, within your 10 feet off the lot lines, as your regulations require. It is an area of town water. The upgrade will certainly be far better than the system that is currently there. So I think it's a reasonable way to approach upgrading the system.
Sounds great. Thank you so much, Jim. Francis?
Nope, Jim covered it.
Excellent. Why don't we start with Kevin Baker?
I have no questions.
Mr. Kane?
No questions.
Dr. Wason?
I was just curious. The ground is sloping away from the house, but you're going to have to put some fill on the downhill side of it. Is that what you're targeting?
That's correct. The grade's going to come up approximately 3/4 of a foot over the system, but we catch the grade before we get to the large shed at the back of the property.
Okay, that's kind of what I was curious. You're not going to run into problems with that shed?
No, we should not.
Okay. I have no further questions.
I see the exception is on the print. Thank you so much for the approval for the exception. I have no other questions. I need a motion.
I'll make a motion that we approve the request for a use of the Presby system with the reduction in groundwater offset from 4 feet to 2 feet.
I'll second that.
Motion's on the table. We have a second. Let's do a roll call vote. Dr. Wason.
Matt Wason, yes.
Kevin Baker.
Kevin Baker votes yes.
Dan Kane.
Dan Kane votes yes.
Kevin Davis votes yes. Thank you so much. Good luck to our neighbors at 92 Foster Street.
Thank you very much. Have a good night.
You too. We are ahead of schedule. Do we want to do the ID distortion support tool?
I can do that.
That would be awesome.
Eventually. Close it. Apologies.
I threw you off. I know. I'm sorry.
I usually have it open, ready to go. There we go. We kind of just bounce upon our COVID stats every single time we meet. I'm not sure if there's continued value in it. I'm happy to continue, obviously, showing it. But at this point, every time I update, it's, oh, look, there's another variant from last month. And we have so little case counts. I would propose we just kind of highlight it, if that's okay with people. Like, I don't need to call it the vaccination rate right now. Wastewater numbers are low. And so if something changes, if it's okay with people, that's when I'll bring it up again. But for now, I think I'm just going to kind of leave it as green. And again, update it, display it, but not necessarily focus speaking energy on it. Unless anybody has a problem with that, I'm happy to change my mind. So I'll just jump right to the arbovirus. Testing has started in Massachusetts for both Triple E and West Nile virus. Littleton is still considered low risk, and we do have our first mosquito test positive for West Nile virus somewhere not too far away from us, but I can't remember where. But otherwise, we are still low risk for that. So now's the time to take precautions to help make sure you keep mosquito numbers down for your season. So make sure you don't have standing water and other things that mosquitoes like to lay eggs in and then hatch. And then influenza and RSV are both kind of closed for the season. So that's what I got.
That's awesome. The West Nile virus case, you said that it was, we had our first mosquito pop in and around the area. You just don't remember where it was.
Yeah.
I just got the report. I can send it to the board tomorrow.
That'd be great. Thank you so much for that. And Triple E, anything the state's reporting on Triple E yet or nothing?
Nothing. Zero.
Yeah. Okay. As far as the COVID stuff goes, definitely have it open. Like you said, unless something changes dramatically with the wastewater or something like that. I'm okay with not reporting it, spending verbal time on it, as you said. How does the rest of the board feel? Any objections? No objections heard.
It's Shrewsbury for the West Nile.
Wow, so far away. Sorry, no, just kidding. Thank you for that. Okay, that's awesome.
Okay.
Does anybody else, anybody in the audience care to comment? Seeing no hands. We are a couple minutes ahead still from our 7:10. So why don't we do the administrative matters? We have meeting minute approval from 5:28. Has everybody gone through and read through the meeting minutes, which are included in our packet? Actually, I have 5:14 in there. I don't see 5:28. I'm guessing it's a typo, and we should be looking at the 5:14. Is that correct? Francis?
Sorry.
Yeah.
Yes, that is a typo.
Okay. All right. Anybody have any comments on the 5:14 meeting minutes? Yes, Dan.
For our public hearing, it's listed as number 2 Elmwood Road, but with our list of included documents, we have 3 Elmwood hearing request letter and plan.
Can you confirm one of them's a mistake?
We'll look at it administratively and correct as required.
Okay. It's either at the bottom or in the paragraph itself. Okay.
It's in both, so we'll go back and look.
Okay. So that may be an administrative correction after we approve. Anybody else? Okay. Need a motion?
I'll make a motion to approve the minutes for May 28th with the corrections as noted.
May 14th.
May 14th, sorry.
I have a motion
Second.
and a second. Roll call vote. Dr. Wason.
Sorry, clarification. That's including the corrections to May 28th and the correction of the listing to Elmwood Road for the
The May
attachments.
28th was actually on the agenda. It was not the 14th. In the agenda, it said the 28th, but it was actually the 14th. So that's an agenda issue, not a minutes issue.
Well, I think it's actually from the 28th, right?
I actually do believe these are from the 28th. Mr.
The-
Chair.
Okay.
The minutes document is wrong, not the agenda.
Got it.
Is what I'm asking. So I say, did
Yep.
the motion include that
Yes, it did.
fix? I just want to make sure.
Yes.
Okay, Matt Wason votes yes.
Mr. Kane.
Mr. Kane votes yes with the administrative corrections.
Kevin
Mr.
Baker
Baker.
votes yes. Kevin Baker votes yes.
And Kevin Davis, chair, votes yes. We'll do better next time on that one. That was a little sloppy. Okay, it is time for our 7:10 public hearing at 4 King Road. People representing 4 King Road, if they would raise their hands so that we can promote them appropriately. Okay, so Mitchell and Matt were promoting. Okay, Matt, are you still wanting to become a panelist? Raise your hand again. If not, we're going to move on.
Matt is the other homeowner.
For 4 King Street?
Yes.
Or Road, I'm sorry, for King Road. All right, so promote. Okay. Let's start with 4 King Road. If either Mitchell or Matt would like to bring us up to speed on what's going on, and then we can talk to Jim and Francis after that.
I'm the contractor that would be doing the
Okay.
work for King Road. Was hired on behalf of Matt and his wife Jess.
Okay. Do you have something to share for the audience?
Well, I thought that when I sent all the stuff you guys would have that all the plans that I sent over to the administrative assistant, I believe.
Yeah, Matt, is there a way that you could share out? Thank you, sir.
I don't have the information.
Matt Wason. Sorry, there's two Matts. So I guess we can go right to the submitted work.
So obviously, if it were to be approved, I'd get a certified plot plan. I spoke to Jim prior. He was saying that, he would recommend not, his recommendation would be to not allow it due to the proximity of the system. So essentially, the current deck is like a 10 by 10 pressure treated deck. It's in really rough shape. The homeowners, it needs to be demoed. The homeowners ideally would like to put back a screen porch in place. That way, something that could fit their whole family on, and then, avoid having to deal with the mosquitoes in the evening. The edge of the proposed screen porch would be 6 inches from the leaching field. The footings, there'd be 3 concrete footings, proposed concrete footings. They could be helical piles, would be 30 inches back from the edge of the leaching field.
Okay. We have Jim talk about his concerns.
Sure. So this is what you're looking at as a portion of the engineer's as-built plan for when the septic system in the house was installed. So it's an as-built plan so that you can see the measurements on there. That's to all of the existing, so the existing structure, the existing leaching area. And it's a really tight lot. There was an old house, I believe, on this lot that got torn down and got rebuilt. That's why this house was there, and that's why they were able to do it. Well before the current owners owned it. You can also see that around the property line on the edges, there's a concrete wall. So extremely tight lot. You can also see the leaching area, the Cultec contactor bed. That's the leach field. It is 14 and a half feet from the foundation. If you look in the left-hand corner, there's a dimension that's provided so you can see that. So that leach field's raised. There's only about 10 feet around that between the system and the wall. Title V doesn't have a offset to helical piers or piles, sonotubes. So generally speaking, I ask people to be at least 5 feet away from their system or their tank with them. And a big part of that is to make sure that they don't hit the system or the tank and do damage. The construction costs are high enough. The replacement of a system, you don't really need that as an added cost to it. My additional concerns here is if that had to be replaced, there's not a lot of room already to get back there and actually put a system in to replace that system. You've got about 10 feet around the walls. You'd have no room between the house and the system at all. So I was concerned that just building out on too much of the lot, building within 6 inches of the leach field. Now, granted, it'll be above the leach field, and the piers will be back a few feet, according to Mitchell. But again, just a little too close for my comfort as far as building within that distance of the leaching area. And again, just looking out for if ever you had to replace the system, how do you get a machine back there to actually do the work?
Okay. Francis?
Yeah, in addition to Jim's comments, I would say bringing a machine back there to install it's going to affect the soil as well. It's going to disrupt the field potentially. And then you're looking at frost heaves that are going to happen over the years that could affect the soil. We've always stuck with the 5-foot standards, and a lot of towns have done this as well. So I feel like in this case, if we allow it now, where does it stop? And it just puts us down a road we shouldn't be going.
Okay, thank you for your comment. Why don't we start with yes, Matt.
Can I just a quick second, if you don't mind?
Go ahead.
Yeah. Hi. So we lived in town for 10 years, and I appreciate you letting us come on tonight. And I was just hoping that we really, it's hard to find houses in this town, and I understand the risks of doing this. But I was hoping that you guys could kind of see the plan from the builder and maybe kind of build a decision off of that. I'm hoping that I wrote a letter kind of, we really love living in town and we love being here, and it's hard to this is kind of the best plot that we have to build something there. There's no other place to build, so it's kind of hard. So I was hoping you guys could kind of see it. We understand the risks that we're getting ourselves involved with, so I was hoping that you can kind of see that. Thank you.
Mitchell, you had another comment?
Yeah, so I spoke with the installer, that worked to install the original system. He said, no matter what, you're not getting a full-size machine in there. You have to bring in a smaller excavator. Even when they did it originally, he said he would have no issue replacing the system. A lot of these lots over near the lake are very, very tight. I understand the 5-foot setback, if there was obviously, the standard lot minimum is an acre now in town, but some of these lots, the older lots near the lake, obviously they're a lot tighter than that. So, I don't know if, setting the precedent, is kind of a different circumstance here than you have, on newer construction. That's all.
I guess my counter argument would be like you informally asked, if you can get something formal signed by one of these installers, I think that'd be something else.
Mitchell, is that something you're willing to work out and get a formal letter from one of the installers saying that there would be no issue doing that?
Yes, I could easily do that.
Okay. Let me go around the board and see if they have any comments. Mr. Baker. You're on mute. There you go.
Yeah, it would be nice if the lot were bigger, but it's not. I don't think we should, restrict them if they're willing to take the risk. And there's an installer, and also if we get a certified plot plan, so we can pinpoint the dimensions and know that the pylons aren't going to be impacting the system at all.
Okay, Mr. Kane.
Certainly having an installer saying, yeah, I'm willing to is nice, but that doesn't necessarily change the fact that 5, 10, 20 years from now, that's still going to be the case, which raises some concerns for me. I think I definitely understand the challenges with small lots. I guess I'm wondering that with a small change in the plan, that we could be compliant with it would appear that we could be compliant with our 5-set offset, as opposed to a 14-foot deck. If this was a 12-foot deck with a similar cantilever, that puts our footings greater than 5 feet away, and would basically solve this entire issue. You lose some feet, or it looks like you have 4.5 feet between the edge of the deck and the Bravo side of the house. Again, I'm not sure about offsets from the plot line, the property line, but it seems like that lost space could be easily recouped going towards the left side of the house. I guess I'm just wondering if we're looking at a waiver process to have footings 2.5 feet from a leaching field, where a small change in the design could remove any of our concerns as far as frost heaves, ground shifts. Any of those pieces could simply be resolved with a small change in the plan.
Thank you. Mr. Wason. Dr. Wason.
Yeah, I kind of was thinking of it similar to Dan, because right now there's a 10 by 10 deck there. Is that correct?
Yes.
Okay. And if since I'm showing it, I think there's a picture of that somewhere, right?
There you go.
Maybe not.
Yeah, there is. There's a picture of it farther down.
Okay. Is that it? Okay.
Yeah.
So I wanted to see the height of it, because technically, right, that deck, right, there's a current footing for that deck coming down. So that deck is basically within 5 feet of the leaching field right now. So one of my questions is, when does the structure cross the line into really having to follow the 5 feet? And it is something with a foundation. And this is kind of more of a question for Jim. As Dan's alluding, is it the footing that we care about most? I'm not totally wild about an overhang. It looks like on this drawing that it might actually be an overhang slightly in the corner, because how are you ever going to get equipment in there? But if I may pause and say, Jim, is it about the structure going into the ground, the foundation of the footing, or whatever it would be for a structure, or is it the footprint?
A little both, but the bigger part that we're worried about is where they're going to dig. So again, Title V doesn't have a dimension for piers. It does for foundations. If this was a foundation, it'd be easier. It'd be either 10 or 20 feet from it, but it's piers. And so the general rule for us that we've used in the office is, and again, it's mostly to make sure people don't find their septic tank when they're digging their piers, is to have them be at least 5 feet off of either the leach field or the septic tank. The overhang, we want to make sure they don't obscure any part of the system. So if they were overhanging the deck, we'd have them pull that back. I mean, the tank, we'd have them pull that back, or the leaching field too, because they need to be accessible for maintenance. So again, there have been situations where, if we have a really good plan of what's there, and we're not worried about the piers, and they're using something like a helical pier where they don't dig, they've crept closer than the 5 feet. Again, the 5 is a guideline. So I just really want to make sure the board's clear on that. There's no real waiver. It's the comfort level that you have with what's happening. And this lot, and unfortunately, many of the lots down on the lake are really tight. And so when you start adding more and more to them, it starts making the systems harder and harder to replace.
Thank you, Jim. And I hear what you mentioned earlier. I also am not wild about just saying, well, we'll do less than 5 feet on this one because it's a tight lot, because what precedent are we then creating that this board is going to be tied to? So that does make me nervous. So I would kind of echo what Dan said, is there a way to engineer this where you can actually get the footings 5 feet away and make sure there's no overhang of the field? And even if that means losing a foot or two in that width, is that worth it? And can you design it? Right now, it looks like the patio doesn't extend to the end of the house. Is that because we're trying to keep the access from that side of the house open? Because it looks like it's about the same 16.2 feet away from the line.
So that is the bathroom window downstairs is where that stops.
Got it.
As far as changing the depth, once you start, because you have the screen porch, you're losing the wall. Once we start getting down to 12, we're really only like 11.6 inside. It's getting pretty tight. I'd have no problem switching to the helical piles where there'd be no disruption of the soil at all. It's just the corkscrew going to go right down in that specific area. Along with I could even get a couple licensed installers to write letters if, and switch to the helical piles if that would allow, to get the screen porch put up. As far as the certified plot, in order to get the permit, I would have to get that. I was just trying to see if it was possible to get the screen porch approved prior to, spending the couple thousand for the homeowner, to get that new certified plot plan and as-built at the end.
Okay, thank you for that. Okay, my comments. I am uncomfortable with having the deck the size that it currently is. If we made it so that we re-engineered the deck so that it was back from within the 5 foot, even for the helical piles, I am really concerned about the leaching field as it exists, and then having to put in a spare unit for that. So again, re-engineering that and getting it so that it's off of that, covering of that area, I think is probably the best that we're going to be able to do. So before the board would also like to see more of an engineered plan if possible. It's showing making sure we've located things appropriately and things like that, so we know where things are, so that way we can better make our use of that. I understand, you're going to need to do that to get the permit, but it sounds like a 12 by 12 or something similar to that would be, I mean, maybe if you did 12.6 and had it cantilevered, you could be, the helical piles could be within that 5-foot area. And then, you could, it would meet within that recommendation of the board. So then you're at instead of an 11.6, it sounds like you're doing a 6-foot stud on the exterior walls for the screened-in porch. So I think that's where the board's at right at the moment. Do the homeowners or anybody in the audience have any other comments?
So do you mean the width could stay the 18 or even increase a little wider, but pull it back from 14 to 12.6 or so?
You're going to need to stay within the 5 foot away from your septic tank as well.
Okay. Yep.
Right. So if you're starting to see the parameters that we're placing for this. So
get it. So the footings or helical piles are 5 feet from the leaching field and from the tank, and adjust the
structure,
the building accordingly.
Yeah.
Okay. With a couple letters from licensed installers, and then the certified plot plan showing the proposed porch redesigned with all of the dimensions, more accurately than just
yeah. Does that? I think that seems to capture what the board was kind of going for, and I don't think that places a burden on the homeowner. Okay. I'd like
No, it doesn't. Sorry. No, it doesn't.
Okay. Thanks, Matt. I need a motion for continuance, I'm guessing is what we want to have. So do we want to continue this, Mitchell and Matt?
Yes.
Okay.
Yes. Yep.
Okay.
Motion
So let's
to
do
continue.
that. If I can have a motion for continuance possibly, please.
I will make
Motion
a
to
motion to continue this hearing.
And do I have a second?
Second.
Motion and a second for a continuance on 4 King Street. Roll call vote. Dr. Wason?
Matt Wason votes yes.
Mr. Kane?
Mr. Kane votes yes.
Mr. Baker?
Kevin Baker votes yes.
And the chair, Kevin Davis, votes yes for the continuance. So, Francis, go ahead and schedule it for whenever our next meeting is. I think, when is that?
I'll speak with an engineer if that works tomorrow, and I'll try to get on his schedule as far as, when I can get that certified
Okay.
view.
So if you get in touch with our office, they'll let you know when the next meeting is that we have scheduled, and that way we can put you into there so you can figure out all those kind of complexities.
Okay.
Yeah, it's 9 July would be our next one. If you can't make that, then it can be the 23rd
Okay.
if you need time.
Thank you. Okay. So that's it for that. Let's move on to our 7:20 public hearing for the Board of Health fee schedule review and vote. So bringing the board back up to speed on this was we had gotten notice from the town that some of the fees needed to be reviewed by legal. Legal has gone off and done their review and came back. And Francis has then gone and looked at things and rejiggered things around a little bit to basically have all of the fees that can be backed by either town bylaws or something like that, and or state laws or rules. And so then I'll let Francis kind of get into that and do that presentation, but that is the background for this. Francis, take it away.
Yep. So everything has been reviewed by legal, and this is kind of the final product. I did send the comparative, which we did across 15 different towns, just to see where the pricing is on everything under the sun for public health. So in looking at the prices, we are in the most competitive price marks, but we're not the highest. Staying within range, making sure we're kind of falling in line with other towns that are doing fairly similar things. So I tried to be as fair as I could while maximizing and making sure that we are getting correctly compensated based fairly on wages and time. I'm happy to answer any questions about any items in particular.
Is there something we can go ahead and share, Francis?
Sure.
Thanks.
So this is our comparative data. First one we have is a lot of food-related items. As you note in the subscript, so the tiers are because every town has different ranges. So to be able to convey the data in something that makes sense, I put it into tiers. So for food service, we'd be looking at different number of seats for an establishment. Retail, everybody does a little different, either square footage or employees. So that's subcategorized as well. All the other areas keep the same name and there's no differentiation and requirements. So those have all been able to kind of go across the board. And at the very bottom, these are the suggested removals for items that we did have on the old fee schedule. As you can see, a lot of them aren't used in any other towns that we did in the comparative. So it's recommended that we eliminate those. So any questions on this first page before I move to the second?
Matt, go ahead.
I do. A couple of questions. Did you skip Acton for a reason as a comparator?
I did, because it looked like it was directly copied from Acton. So in trying to do a comparative, Littleton would just match up basically directly. So I can tell you that everything that Acton had matched up to Littleton. But we really need to look at a larger scope of towns. So if one town versus 15 other towns are doing things differently, I mean, Acton's not the best comparative, and I've been told that the fee structure they have is concerning. And I mean, it's so, you're talking about council also, like some of the prices are just so high, you can't really support that.
Yeah. And then what, let's see here, towards the bottom down here, reinspection is blank. So do you charge for reinspection, or how does your process work?
We do not charge for reinspection. That would be up to Littleton whether they want to do that or not. Essentially, when you're reinspecting, you're having to go out of your way, and you're going to spend potentially another hour going back at least. That is not really factored into the original permit and the cost and all that. So it's a question of whether we want to charge facilities that are not keeping in standards, where we have to spend that extra time where we could be doing something else, whether that's worth pursuing.
Yeah, I mean, I think if you look at several of the kind of lower numbers, they often have that as a line item, and I think we did originally have that because, as you know, we kind of used Acton as one of our basis. But I think you're stuck either saying that you're going to have to include something separate for a reinspection, or you have to calculate out how likely a reinspection is and then include that in your original fee, because the fee has to cover the manpower and time that it's going to take to do the work. And we can't leave it as a reinspection is a freebie then. So it's either all the fees have to go up an incremental amount, or you decide they set at a certain amount and then we tack on a reinspection. That's that's probably seen as the more fair version, because then the good establishment isn't getting dinged with a slightly higher fee to cover re-inspections at other establishments. But you said, is that a town decision that has to be made or a Board of Health decision?
I would see it as a Board of Health decision.
Okay.
It's town policy.
So on the one that we're reviewing that's included in the packet, the re-inspection underneath the food is actually a $50 fee for the one that's proposed.
Correct.
Yeah, sorry. Yeah, this one has the, you're right, it's added on there as a 50.
Oh, okay. All right. No, I just wanted to make sure we were talking about the same thing, because I'm like,
Yeah. On the I guess our yellow banner one that we're looking at originally.
yeah, totally.
And so then my kind of next concern is, let's hear. Sorry, I'm looking at my packet. So looking at the smaller version. Can you look at the other one you were just going to show? Yeah, that one. So one of the concerns I have is that the Neshoba numbers are from FY20 at the most recent, if not older than that. And so I understand that there's concern, and we have to make sure the fees are reasonable, and we have to make sure that we can show that the fees cover the work that has to be done. But I'm just kind of blown away that we don't have to kind of bump things up higher for some of the numbers that are that many years old. I believe the Acton one's from 2018. So while it might have been seen as high then, I'm less convinced it's seen as high now. So I would say for a tier 1 food establishment that's, say, less than 50 seats or whatever that might be, what is the hourly cost of doing that inspection? How many hours does it take? And I'm not sure this is now getting a little bit even further afield of, we don't have a food inspection agent in the Littleton Department of Health. We have a director. And so therefore all the work that is being done in the community is being done by our director. And so do we have to account for that in terms of, again, going back to what's reasonable? Well, if it's our director doing the inspection, then it needs to be that hourly rate, which is obviously both wages and benefits and everything, and how much time does it take? So Francis, if you had to say, what does a 50-seat restaurant take to do an inspection of on average? How much time is that, including travel time, inspection time, paperwork time, and review?
So the Neshoba prices, these are, I believe, current. And Jim, can you look at these real quick on the screen?
You're muted, Jim.
These look like our current fees. I mean, they're going to go up 10% in July, but that's the increase that would happen.
Yeah, I believe that they're current. What I'm saying is that they were current in FY20 when we created our original budget.
We've been bumping the fees up. Oh, okay. We've been bumping our fees up since then. So they're from 2020. Those are higher fees than then.
Okay.
Yep.
So let me just make this clear. The column that's Neshoba, those are the correct fees right now. For like today, July 1st, you said they're going up 10%.
Yep.
So that our fees actually seem to be in line with the proposed ones. The proposed Littleton are in line with the proposed Neshoba that's going into effect July 1st. I do also want to say that we do need to have fees in place July 1st. So so we're going to have to put something in place tonight, so that way we can get those fees there for the Board of Health to charge appropriately. Any other comments on this first food section?
Well, I had an outstanding question, Francis. How long does it take to do a 50-seat restaurant?
Oh, sorry.
All in.
50-seat. Depends on the food, but let's call it like an hour and a half, 2 hours.
Okay.
Dan, I see your hand raised.
I'm going to follow up on that real quick and then another question. But so 2 hours, that's reviewing submission, getting there, doing a kitchen inspection, training inspection, everything else, and then writing out the report afterwards in 2 hours.
Rough for 50 seats. So let's say like a pizza place.
Yeah. Okay. I'm just making sure that I admit for me, that seems quick.
Depends how good they are.
Well, I think that is one. How long does it take to do a thorough inspection? How long does it take to do a typical inspection? So not a best case scenario where here's our binder with all of our employees and all their certifications and all their paperwork. Here's our place and our temperature logs and they're perfect. When everything is perfect, it may be a certain amount of time. When things are perhaps more typical, they may take longer. When things are not as organized, it may take longer. I just think we want to make sure we don't want to base this on best or near best situation. We want to think typical. What does a typical take? Which is some challenging, some awesome, and then everybody in the middle of the bell curve. For re-inspections, I'm assuming that is for a just cause re-inspection, not for our twice a year inspection, right? That our $400 for a tier 3 covers 2 inspections per year.
Correct.
Okay, so
yeah,
as we're thinking about how long does an inspection take, 2 hours, give or take, for a 50, that really is 4+ hours because we're doing it twice a year. So as I think about an hourly rate, right?
Right.
So
but I tried
if your
not to
hourly
focus-
rate is,
I understand.
whatever, pick a number, 50 an hour, that's 4 hours, that's $200 just for 2 hours twice a year for a perfect, easy 2 hours from I've opened the email requesting it to I am done and signed the form at the end of it twice a year. I just want to make sure that we're kind of thinking of what's really involved, because all these food inspections or for retail and restaurants are twice per year at least. And then that re-inspection is going to be for cause and re-inspections or complaint or concern.
I certainly understand the point. I tried to really take in consideration what other towns are charging too. I don't want Littleton to be the highest one on the list.
Yep.
So
and I'm not saying we should be, but I just want to make sure that as we're looking at this, we recognize that the workload involved in an inspection is really 2 inspections minimum per year.
Right.
And then obviously concerns, complaints, problems, or a for cause re-inspection after an initial inspection. That there's a lot more wrapped up into this. So I guess that's my only thing, is certainly balancing. I know there are a desire to be as revenue neutral as possible, which I'll be honest, I don't think is necessarily realistic from a financial perspective. Health departments aren't revenue neutral. It's not how it works. But we obviously want to make sure that our workload is appropriately compensated by the users of that service. I think that was my only piece. And so I guess I'm trying to compare. So like our 250 here, so we have retail tier 2, 5+ staff is 250. So to me, 5+, what is that 5+ staff? Is that per shift? Is that total employed? What does that look like?
That'd be total employees.
Total employees. So my 250 retail tier 2 would be anything from a small gas station to, let's use our real examples, Market Basket. Because an average gas station is going to have more than 5 employees.
So Market Basket and Donaldson's would be in a separate category of grocery. Those 2 alone would make up that category. That would be 500.
Okay.
So retail
Cool.
would just be strictly canned goods and things that are PHFs and maybe some drinks as well.
Okay.
But so in the removing the other items, those were basically built into the grocery because that's where those would have came into effect.
Gotcha. All right. Sorry. Thank you for that. I appreciate it. No, I think I'm okay at the moment. Okay. Thank you, Mr. Chair.
You are. Mr. Baker? Okay.
Thanks for the conversation. I think this looks good. Thanks for sorting it out, Francis.
All right.
Well, if I may circle back then on the inspection, kind of along the lines of what Dan was saying, I would be surprised if a reinspection could take less than an hour with, again, transport time, additional paperwork time. I know the time on establishment might not be that long because you might just be walking in to check to make sure one thing is done, but reinspection should also be for something a little bigger. It has to be an average of the work. And so I'm nervous about reinspection only being $50 because I think we realistically probably need to be saying things cost $75 an hour. I mean, I would start there. I wouldn't even want to consider a $50 an hour as an estimate because I just don't think that's realistic for our staffing and other expenses. So if I look at that and say it's $75 an hour, I'd be hard pressed not to have the reinspection be $100 to start, if not something a little more than that. But so that, I think that's the only one I had left of being kind of nervous about. I think the rest of them are probably pretty reasonable. I'm not sure if at farmers markets like per stand or market as a whole. How does that one work?
That'd be per
stand. Okay. Then I think the rest of them are more reasonable and kind of match each other. So I think the last one I have is just that reinspection.
Okay. From the chair's perspective on all these things, I'm not going to I'll pile onto the comments. I hear what said. I do appreciate Francis getting this together so we can have something in place for July 1st. The one comment I have about reinspection, and maybe this is something that we can isolate out of the passage for this, is that we set it at $50 and we look at it another time in the future. But can you make a reinspection a unit of work? So in other words, can you say you set it at some hourly rate, so it's $70 per hour reinspection? Can you say, instead of a flat fee, can you have a flat unit of work and say for every hour that you're spending on reinspection, you're charging that unit to that? I don't know if that's legally there or not, but that would be one of the questions I would actually ask.
I guess my only concern would be that, let's say someone kept you longer because they want to learn more about the process, they want to understand better, whereas someone else is asking no questions because they don't care as much. Then we get into how is that fair, maybe to some degree.
We'd also have to keep time tracking records to be able to justify any sort of hourly charge.
Fair.
And I think it's not just all one block, because Francis is going to have to come back to the office and write something up and get it back to the restaurant, and they're going to have to act. You know what I mean? It's like that cyclical stuff that's broken up, and that's what makes me worse, because that also makes you less efficient. So it's not like you can just get it done in a half an hour just in one little chunk. You've got it. There's more work and follow up. And what about the restaurant that doesn't call you back and return your phone call? You start to add up all that stuff, and it just makes me nervous that it's nothing against you, Francis. I think you're not giving yourself enough credit for how time consuming it can end up being.
I was just thinking back to, when you go to take your car into the shop, they have a certain, a book that says, it takes an average in 700 hours to change a right front brake. Not that that's what it is, but there's the book rate, and that's what you get charged, blah blah blah, and then there's the hourly, and then it's like 2 of that or whatever. Okay, I hear it. I hear the feedback. Okay. So why don't we go ahead and move on to the next section, the other miscellaneous, or whatever you have, Francis? Sure. I'm sorry. Hand was raised. Yes, Dan.
So just a really quick question. I see function hall, we have a line, but it's blank. I was kind of curious. I'm guessing it's under catering, but things like church kitchens, VFW, the Masons, what is it? Kaliva was a function hall as well as a club. So some of those kind of things, do those fall under catering? Where do those land in this mix?
So function halls I left blank because I wasn't really sure. It's mostly churches typically have function halls, or like you said, the other categories there. And those are typically not for profits. A lot of towns typically don't charge for them, but if the board does want to charge, that's fine. We currently don't charge for them, basically. So
I'm not necessarily suggesting we do. I just want to make sure that we are mindful if we make that choice. You know, if we're going to make a nonprofit exemption, that we just kind of think that way through as part of this. That nonprofits are exempt from inspection fees. We just want to be careful we don't wipe out other inspection fees that may also be involved. You know, if I'm a nonprofit with a beach and a well and portable toilets and a tanning booth and a kitchen, and that we're spending 20 or 30 or 40 hours a year inspection for without recompense. I don't see that happening. But I just want to make sure that we are making a thoughtful, mindful decision that that's excluded purposefully.
I can put it on a list to table to a future meeting because we don't really get into it until the fall, basically. So if you want to just do that.
Okay. Any points of discussion for this section? Okay, let's go. The next section is, at least that I have in the packet, is other miscellaneous. Any other, Francis, would you like to walk through it, or is it pretty self-explanatory?
Yeah. Not really much to go through. Just look comparatively, and this would be competitive without being the highest.
So we do actually have a campground that's in town. How would that work?
So we check that once a year. The Neshoba charges about $10 right now. So the recommendation would be charging $75. Obviously, as you can see, there aren't that many, so It's kind of hard to say. But that seemed like a fair amount, considering they're going from $10, and also there's not that many on the list that charge. If they have them or not, I don't know.
Right. What's the difference between a campground and a recreational camp?
Campground would be like actual camping. Recreational camp would be like a day camp that we have in town.
Got it. Okay. And it also looks like we're removing the fee for the beach.
So we don't charge the beach right now, and the beach is town operated. The recommendation with council is that we should not be charging the town anything owned by the town or run by the town. So essentially, that would be the town running the beach.
Okay. So if the only thing that comes to mind for that would be something over in Westford, like the Tiki Bar that has a beach that's there. But Littleton doesn't seem to have something like that, right?
So we have the town beach.
Yeah.
Camp T uses it.
Yep.
Yes, to answer your question, Kevin, that line item came and was called semi-public beach, not town beach. So you're right, we don't have an example of that.
Okay. So I guess we're making the decision then, and we don't need to carry it forward. It's just something that we would like not have to worry about? Question mark.
Dan has a question.
Go ahead, Dan. I'm sorry.
All right. I think it's the Manawanaki Association, Neighborhood Association. I know they kind of have a shared beach access, I believe, but I'm not sure how that falls. Is that private beach because it's the association? Is that semi-public, or does that not really exist officially anywhere and it's just their thing? I'm just not sure. That's the only other place I can think of. Tiki Bar, but that's over the line. Matawanaki on Forge Pond is the only thing I can think of that kind of might fit that more public. I don't think Neshoba Day has waterfront access, do they?
They do.
They do. So their waterfront would fall into the recreational camp fee, or is that also a beach fee?
So that was just kind of built into the camp.
Okay. Water, since we're talking about beaches, I'm not sure how Manawanaki works, and if we need to look at that. Obviously, for camps, part of the, for waterfronts and beaches, part of that inspection fee is sanitation stuff. It's also around water quality and water testing. How is that incorporated into this model? Obviously, for Long Lake, that is, it's town property. We're managing it as the town. But let's do for Manawanaki, if it's open, for Neshoba Day if they have waterfront. Is that on Long Lake? I always forget which lake that on, if it's on the next one over.
Jim, do you know about Manawanaki?
So the regulations for bathing beaches from DPH is for both public beaches and semi-public beaches. Semi-public being like the campgrounds, associations. Never got a clear answer out of Manawanaki. I've never really seen a beach area. There's more like a boat launch area. So I guess it's a judgment call. Is it a beach? If not, Camp Neshoba does have a full waterfront. And so that's certainly a semi-public beach and has been licensed as a semi-public beach right along. As far as water quality, the regulations for bathing beaches require that they do a coliform sample, E. coli, sample 5 days before they open, and then once a week during operation. Those results get submitted to the board. We send them. The state of Department of Public, actually, I'm not sure which branch anymore. Bureau of Environmental Health actually has a beach portal that the information gets uploaded to, and actually you can go online and look at the dashboard and see the beaches once the information's up there. So, and we do the same for the town. The town gets tested 5 days before and weekly during the season.
Good. Okay, so the operators of the beaches, or the responsible parties of the beaches, are responsible for conducting the testing, having it tested, and having the results submitted. So we're not running those tests and submitting. Their part of the operational responsibilities are to perform them and submit data.
So currently Neshoba does the town beach. Francis will work that out with the rec department. Neshoba pulls their own sample but submits their results to us so we can upload them.
Yep. So going forward, I'm ready to rec that they have to do their own.
Okay.
Awesome. Thank you.
Does anybody else have any other comments on the other miscellaneous section? Okay, so coming out of that, I just heard the Manawanaki Beach. Just looking at that, something that we can look at outside of the approval. Okay. That looks like our final one is septic. Is that correct?
Yes.
We could display that really quickly. There we go. Does anybody have any comments on septic categories? It's 0 to 99. I'm confused.
So it's 1,000 gallons, and
got it. All right. Now
I worked with it on Jim Gareffi because he's going to be changing his as well to very similar ranges.
Got it. Inspections, you also have at no cost.
I do.
Down at the bottom there.
Yeah. Where are we? So if we look at it, if you look at the septic construction permit, it's built into that instead. towns typically don't charge per inspection from the comparative. It's just kind of built into the permit fee itself as a separate charge. For like anything else, you get a permit and the inspections are included as part of that permit price.
Okay. Is there any, from an inspection point of view, do we have to go out and inspect a septic system that is, less than 10,000 gallons per day? Do we have those inspections that we have to do in town? And if so, is that one of those things that the permit price doesn't cover those annual inspections or something like that?
Yes, typically be looking at 2 to 3 inspections, depending. Maybe more, depending on what might need to be revised.
Okay. So, but the inspection itself, there's not once it's in and approved and signed off, there's not a yearly inspection that has to happen for those systems?
There is not, no.
Okay. All right. Does anybody else have any other comments on the septic categories? Yes, Mr. Wason.
So this is obviously one of the ones that our older fee structure had probably too many things, but we did vote and approve on it. And so I just want to touch base on some of the things that are going to no longer be included and make sure we're all on the same page. So we had a section, I know this is a question, we had a section on public sewer connections. Does the Department of Health not do anything at all in that scenario now?
We do not. I didn't really know so the only thing we would do is witness the abandonment. We wouldn't really get caught up in sewer connections themselves.
Okay. And then there was obviously the stuff on treatment plants. We're getting rid of that section, correct?
So yes, that was recommended to get corrected.
Okay. Because this was I'm scrolling through the other one. I didn't see anything else in the. You didn't list the suggested removal, so I was just trying to compare line by line to see.
I figured since it was kind of more standalone, it would just kind of make more sense just to put it out.
We always wanted to kind of clean this up and make it a little neater. And then there was a hazardous material section.
Yeah.
Another one that I'm not sure if we had anything for it, but it was there. So just in your opinion, not necessary or doesn't apply?
Yeah. So a couple towns do varying. Right now, I really only see it. So I've had experience with biosafety, like pharmacy companies coming in, and they have a lot of hazardous waste storage. The only thing I can think of is tanks. Jim, is there anything else you can think of for hazardous waste that would be applicable?
No, if you had bylaws and we're regulating it, if you're doing inspections for it, again, back to your comment, Francis, about biomedical facilities, a Boxborough kind of got blindsided, a place moved in. Unfortunately, 3 or 4 years later, the market didn't support it anymore. So the board actually had a permit fee because it was a pretty extensive review of plans and walk through facilities and making sure they had industrial waste holding tanks and that they had the hazardous waste removal. So in that case, the board charged what they considered a reasonable fee for that.
And then has it been decided that we also don't get to apply or we don't have the regulation, or do we want one for the sewer treatment plant ongoing? We're saying that's handled at the state level and we don't have any responsibility and cannot have any responsibility.
I believe the legal explanation was that it's basically doubling efforts, and if they're reviewing it and they're the ones who are supposed to be signing off and issuing things, that we didn't really have a standing for it.
Oh, okay, but my more important point, that means you'd never get asked to do anything with that facility. Because if work is going to fall to this department, then this board should consider creating regulatory language about what then our oversight would need to be, and pass something so there should be a fee. If it is nothing, I'm totally fine with that. but it has to be zero then, because the state has to be 100% responsible.
I don't know, Francis, if I can pipe in just with the experience on them.
Go for it, Jim.
So here's where our involvement's been in my experience. Title V inspections aren't required on wastewater treatment plants. So often and that's a big part, that's a lot of time, because often realtors will call and say, hey, I need a Title V for that site. And we say, it's not a Title V system. You got to call the state and get the groundwater discharge permit. So generally shift them off to that. The board, the wastewater operators, by regulation, send the board their operation and maintenance reports and water testing. They're really more for a courtesy to us. It's really DEP's responsibility. So I have sometimes taken the opportunity when I don't think DEP is moving fast enough to poke DEP and say, hey, what are you guys doing about this? Because we can take a look at the numbers too, and we're a little more closer. So that's typically a kind of an elective opportunity at that point. And if they fail, and if an operator is not doing something that they need to do, or if they're not meeting those standards, it is really the state's responsibility to make sure that they correct those activities on the operator and the owner's behalf. Again, I look at it having those reports as a mechanism for the board to, if somebody's not moving fast enough and it may be a greater public, we can see it, the state can't. So it's nice for us to say, hey, you guys need to really take a look at this because we think it's impacting more than just a failure of a permit condition.
So following up with that statement, then something like the point maybe where we might need to have a slightly next phase of the system to kind of.
Well, and again, that's really the state's responsibility and the owner's responsibility, because my original understanding of that site is because wastewater treatment systems are often a biological process, and because if you put too big a system in and put too little flow in, it doesn't work well. The original permitting was to kind of do that in a modular style. And something happened at the point where the flow was growing and the system didn't grow with it. So I think that's where we're having it. Plus, there's some kind of grease issues up there, whether they're lines that don't have enough pitch. So we have gotten complaints. At least a couple of the facilities have had flooding, but they're more. Their owner complaints about the discharge, and we turn them back on the state saying, hey, look at owner of the facility, you guys need to clean it up, make sure it's working. Wastewater operator, you need to figure out why it's not. And DEP, you need to kind of get these guys to do what they need to do.
Okay. Just checking.
Yep. Just my experience. I mean, there's, like I say, DEP really, but they're covering it. Littleton's in the central region, and there's probably, 80 towns. So we're on the ground and can see it, and we can be the voice to kind of push things if we need to.
Okay. All right. Does anybody else have any other comments in the septic area? No. Okay. So just going back over the action items that I heard coming out of this, re-inspection, we just want to make sure that we have an accurate number for that. So that might be a future meeting sort of kind of vote. Function hall, sounds like we're okay with the function hall. Sounds like we're making a conscious decision to for nonprofits to be okay with that. There was some discussion around the beaches, but it looks like we're okay with where we're headed with the beaches as far as fees, because mostly that was the town. We will have to go look at the other semi-private beaches that are in town to make sure that this doesn't cover that, but that's something that we could reintroduce as an amendment to the fees at some future date. I didn't hear a large objection to that. And then I think we were good on the septic categories. Matt then reviewed all of the other pieces that were dropped as well. I appreciate that, Matt, to get that done. So I think that's where we're at. Did I capture all of the actions coming out of this? Because I think at this point, I would be comfortable moving forward with a vote on this. Matt?
Just want to clarify. I agree with everything you just said. The portable toilet one.
Oh.
Is that one that we figured out we do have a regulation, and so we have to start doing that permit? Is that correct?
We're doing it currently. It just
Okay.
hasn't been posted with the clerk yet.
That just spurred the memory from past time when we were dealing with that one. And then the other one I want to bring up, which doesn't necessarily be on here today, but I need it on the radar, and that is some sort of review process for industries expected to produce odors that might be problematic for adjacent homeowners and the like.
So what you're saying
So it
is you'd
doesn't
like it.
exist, right? And this is also be a Jim question of what's your experience. It sure feels like something where we've kind of been dealing with one of these kinds of issues. And the last time it came across our table, it was kind of a courtesy that we were being involved in some review that frankly probably should have been something more of requiring our approval as opposed to just asking us to glance at it. And like I said, this is not a tonight thing, but is this what's the next step? Is this we need to create a regulatory document or some sort of thing to say this board, I think, should have oversight over industries or commercial enterprises that produce odors or are likely to produce odor complaints if they do not have the right systems in place. Not that this board has the expertise to say whether they do, but we have a great health director and we'll find the engineers that can help us in that scenario. But step one, I feel like has to be something along the lines of, right, like get something started and add an annual fee for that. What thoughts?
Maybe
ideas?
nuisance related.
Pardon?
Nuisance
Maybe more
odor
broadly as
related.
nuisance.
Yeah, nuisance odors.
Yeah, but again, something that you kind of that if not done right, it will be a nuisance. Like it guarantees a complaint if the proper job isn't done up front in an establishment like that.
Or if the
Right?
filters aren't changed enough, or there's not enough carbon in the filter, or ...
They have no plan to clean the air. I mean, like, right, it could be anything. And so it's the same as, right, if I had a horse stable and my plan for the manure was to just dump it behind the barn, that will be a problem, not just for the soil eventually, right? So
Right.
maybe not the best analogy, but the best I could come up with right this second. So I throw that out there. And like I said, I don't know where the right first step is. I have no idea if Massachusetts has any guidance on this, or where we start.
So
But I throw that out there again.
that sounds
I don't want to hang up this particular vote on this fee schedule, but I think it's a missing piece.
Yeah. So I have definitely taken that as a note because we spent a lot of time reviewing that and having to go through that process. So, I think the first thing that we can do is reach out to our town council and talk about a regulatory for nuisance odor fees for inspection and things like that. We'll figure that out.
So to your point, Matt, the air pollution control regulations of the state allow the Board of Health to enforce them. And that's when we were dealing with the facility, that's what we're using. And consequently, the Cannabis Control Commission has built into their approvals that the operators have to comply with that. And so the activities that we had back, January of, was it last year?
23.
Was it? Yeah, where the planning board issue is coming up. I think those are the actions that the board should be able to have, sign off on building permits. Because again, I don't have the expertise, and I think we finally wrangled them to say, hey, look at somebody you need to hire, because businesses will come and tell you, oh, these are the most wonderful filters. And many times, at least twice, I should say, we got programs on how they control odor. But then there was always something else that allowed odor to seep from the facility. And so we need somebody who is a mechanical engineer maybe to kind of take a look at said facilities and say, here's where odors are created. Here's the sizing, the vents, the ducts that move the odor around and collect we need somebody who can do that. It's not me. So that we could feel comfortable that a facility is built that we don't expect is going to have an issue with odor. And I think that's what we didn't have in this case. But we did ask them for the expansion to take into consideration.
Yeah, but then the expansion, this board was mentioned, but we had no oversight. So we were not a block in that process.
So it sounds like the Cannabis Control Commission has actually deferred that to the Board of Health type thing. Is that correct?
I think what they do is they say that applicants have to comply with the air pollution control regs.
Okay, so maybe so Matt, I think that's something we definitely want to add to a backlog that we visit in the future and move from there. How's that?
Yep.
Okay.
Yeah, I said it's not a now thing. But I feel like it's something we need to get so that we don't get caught in that situation again where we have no regulatory oversight, so we have therefore no official say, and therefore we don't have any control. And then it's great, we're empowered to deal with the problem afterwards, but that did not work well. So I think it would be far better served for this community if this board was involved at the start of the project with the reviews, with the engineers, to hopefully get things started on a better foot.
Sounds great. Okay. Duly noted. I will pass that along as my notes to Francis after this meeting. So that's there. Does anybody else have anything they'd like to chat about this before I would like somebody to entertain a motion? Hearing nothing else, do I have a motion?
I'll make a motion that we adjourn.
Okay, well, we still have one more item on the things.
I apologize. I make a motion that we accept the proposed fee schedule for the Town of Littleton Department of Health as submitted.
A motion on the table for the fees as presented. Do I hear a second?
I'll second.
I hear a motion and a second. Let's do a roll call vote. Kevin Baker.
Kevin Baker votes yes.
Dan Kane.
Dan Kane votes yes.
Matt Wason.
Matt Wason, yes.
And Kevin Davis votes yes. Excellent.
Thank you.
We have one final item on our agenda, the 750 correspondence. Any board member updates? Yes, sir.
This board needs an update on admin support for our department.
I do agree with that statement. So one of the things that has happened, Megan has accepted a position in the accounting department. It was a competed position and she was selected for that and is transitioning. I have sent an email, hopefully, to the town administrator following his email for that. So I'm hoping to hear back from the town administrator. Francis, have we heard anything from him after that was sent?
I've not, no.
Okay. So yes, definitely we need to figure that out because we don't have an admin tonight and we need an admin to take notes for the meeting. So okay.
So just I'm sorry, Kevin and Dan, do you know that what has happened with the reshuffle? Okay.
Oh.
So that's what I'm saying, that this emails can't go to everybody unless we have them sent officially to everybody.
All right, so let's go through this real quick. So after she competed with that, the town administrator came back and said that due to staffing or whatever, that we're going to go from 2 2/3 person to just 2, and the 2/3 is going to go away magically. Right now, after a conversation with our select board representative and Francis, I'm reaching out back in an email saying, because he said in the email that there were he looked at and evaluated efficiencies and had numbers which the efficiencies allowed for the reduction in the staff. And so my email back to him was to please detail the metrics used to determine the efficiencies so that way we can concur and have a discussion at the board with those number so that we can discuss what's really going on there. And I haven't heard back from that yet. So that's where we currently stand.
Yeah, it's very confusing from the email. I get the sense it was 2 2/3, and now it's going to be 1 2/3.
It's going to be they just dropped the 2/3. It's going to be 2 full bodies. That was what I got out of it. Francis, is that what you understood?
Because it says to restructure the 1
Right.
and
So we lost
2/3 admin positions, plural, to share in the duties to support lands and building. And part of the issue as well is that sometimes he says BOH and CC, sometimes he says building, sometimes it says lands and building, and so it becomes confusing as to where we are. So this has happened. This ship has sailed. Kevin, thank you. I know you've followed up to try to get some kind of detail. One of my concerns is that the way that we found out about it was we were informed that town administration had made this decision, and so I think we have a question out to the select board of, how and why is this allowed to occur without this board's involvement at all? This is our budgetary position. We are not a board beneath the select board. And so for our positions and budgetary dollars to be kind of moved around like this, I think is not appropriate without involvement prior to any decision making.
Yeah. Part of my email stressed. I just was going after the metrics, but I appreciate that. And if I don't get no notes back from that, I will be sending out a much stronger worded email. And Matt, I will ask you for a review on that email before it gets sent out, so we can make sure that position is appropriately stated. Dan?
Okay, just so we can be clear. So right now, we have Francis as our director at 1 FTE. We have a shared nurse with Acton, who we're at a third of an FTE, half FTE, somewhere in that ballpark. And then we're going to have a quarter-ish of some other administrative support. We don't know who that person is, or do we know who that person is? Shared between us, conservation, building, somebody else. Is that a person at the moment, or is that a theoretical position yet to be identified from the available administrative staff in town hall? And that might be more for Francis than for the chair, but
so that the absorption would be the full-time existing employee.
That's not answering my question. Who is our current? If I had to say, hey, Francis, I'm just going to drop this off with the admin. Do you have a specific person you would point me at, or is this still just a theoretical person without actually a name attached to that quarter FTE?
Right now, it would be to another existing employee in the office. Megan is no longer
with us. But we don't know who that is. But we don't know who that is.
We know who that is.
Oh, okay. Okay, so we have a quarter FTE in the budgeted position is now just disappeared.
The budgeted position is still there as far as I'm concerned, because that was a past budget and that's what town voted on. So that money is allocated for that budget item, and only this board, from my opinion, can move that allocation.
And it's a half FTE, isn't it?
It was a half
of a person with conservation.
Right.
But town administration has chosen to not fill that position.
I said, due to efficiencies, they have enough people to handle it all. That's
like I said, nothing like what I said in the email back to that person. What Dan was, I would really like to see the data for the efficiencies that were gained, and to gain a better understanding of how you believe the elimination of that position can support the Board of Health and their mission. And I haven't gotten anything back yet.
And I apologize. It didn't even dawn on me that Megan actually wasn't on the call tonight. So clearly it's broken. There are supposedly people in place, and we don't have anybody taking minutes tonight.
I admit, I wish I would have known this at the beginning of the meeting, because I admit I've taken my little discussion notes. I have not taken anything near the level of minutes, and having done minutes for this board for a big hunk of my first year, I would have approached this meeting differently. So I actually was aware as clerk that I needed to produce minutes for this meeting.
I'm sorry, Dan.
That's my fault.
I'm sorry.
Yeah, I just in general, I'll admit the fact that we lost our administrative support is kind of here at 8:30. It's kind of buried the lead of oh, by the way, town administration, that we have lost our administrative support, and town administration has decided not to fill that position, and we're just going to kind of tag on with somebody else. That's a lead. That's not a 8:30.
Well, but if that's the plan, then that person should have been here tonight too.
I'm going to point, because I have no choice, but to Francis as the department head was the person who, yet to be named, although you said you have a name, told that as part of your responsibility at 7:00 on Wednesday night, we have a board meeting, and that as part of your administrative responsibilities being there to be.
We have not really been told to hand down any information yet whatsoever. Tonight I'll be doing the minutes and rewatching.
So we don't have an admin then.
Obviously, there's not a clear answer to that question at this point, Dan.
Okay, I just want to make sure, because I'm trying to get to that. Either we do or we don't.
I think the answer is,
but I think we don't. Really,
I think the answer is that there's a human, and it's not an open position that needs to be filled that will take time. As to which human's going to end up with which piece of the pie, I'm assuming that's kind of still what's happening. But there's no vacancy to fill.
So, right. So, again,
because they're choosing not to fill a vacancy, they just haven't figured out who's going to pick up the workload. The pile of work is still in front of people. They just haven't figured out who's picking up which piece of work yet.
So, we have the position that was filled by Megan before, so we know what the workload was, because it was an advertised position that was filled. So we know what that workload is, and that's been described. So now what I basically said in that email again is, please detail the efficiencies shown to relieve that workload for this position, right? I'm not. And so that was the excuse given in the email as to why this rearrangement could be done. I am basically saying, and so tonight, part of the thing tonight was also, and yes, I should have been more prepared to say something like, hey, Dan, by the way, it looks like Megan didn't show up tonight. Could you have taken it? That's on me. I'll take that one. But it's to show also that, hey, look, we need this support, and this was part of the detailed support that was part of this. So, yeah, that's on me. I'll take that one. I'll take that arrow.
I mean, I care less about them showing their efficiencies. I don't care, as long as it doesn't impact me. We should still get our same amount of support. If their efficiencies don't come to fruition, then it has to come out of somebody else's time pool, because that was their decision. Of course, does that really happen in the real world? No, then we get concerned. I agree. It's a reasonable thing to ask, but that's not really what I care about. I just care about we are getting the support that we already got, which we are not at this moment in time.
Right, which were allocated in a budget, which was voted on by town, and now this is where this is. So you need to go. I need, like I said, need to see the efficiencies. So we'll figure that out. Mr. Baker, you have pensive thoughts.
I have lots of thoughts. I'm not going to say them right now. So.
Roger that.
Smarter man than me.
I'll follow up with you, Kevin. Any other discussion around that topic? As it is 8:30. Sounds like we've gone down that path. All right. Any other comments then from the board? Any other updates or correspondence? I have received none.
Our nurse starts next week. She's ready to go. We've been coordinating action. We're actually going to start off on a couple projects together jointly, because they have a bigger department. They already have some stuff in the works, so we're going to piggyback on that.
Awesome.
She will not be housed with us though, because we don't have any space. So I found a spot for her in the new senior center, where she'll be working with the volunteer nurses and kind of getting an introduction into the community and being part of the events that they have every day. So that should work well for at least the interim.
Okay. The rearrangement letter did talk, however, about promised spaces finally getting to the Department of Health. So that was good.
So we were told today that plan might potentially change to something else as well.
Of course. I'll follow up with you on that so that I can be better informed. Anything else there?
I bought a human-sized skeleton for the nurse. It's a welcoming gift.
Wow. So
I was told it's important to have.
that and a BP cuff and a stethoscope too. So
I got those too, though.
Do we have a naming contest?
So
Skeleton, absolutely.
the skeletons need to have a name. So maybe we do something with Shaker Lane or something like that to name the nurse's skeleton or something like that.
That school's out of session. Yeah. Library reading program.
Yeah, that I think next year I think we should definitely reach out to the school board and propose that as a name. And that is actually a very important and traditional thing to do. I know it doesn't seem like it, but my wife, who is a professor for human anatomy and physiology at Framingham State, she had her opportunity to have her full-size and articulated skeleton named appropriately by her first-year students that she had some 20 years ago. So that's a thing. So definitely want to go down that path and have the naming rights. So maybe we'll go off and do that for if the nurse would so be kind to do that. You might want to chat with her about that. That would be a really good outreach thing to do with our schools.
Yeah, after I surprise her with it, I'll let her know.
Walking around the corner with a dead hand or a skeleton's hand coming around the corner. Okay, I see how this is going to go. Okay, what could possibly go wrong? Okay, do we have anything else? Nothing from the board. We do still have a member in attendance in our audience. If the member in the audience would like to share, Francis, yes.
That's our intern.
Oh, well, hello, intern. Elsie, if you would like to come on up and say a few words, you're more than happy to. You can also choose not to. We're not going to force you to get onto the board to say hi, but all of us do welcome you, and feel free to reach out to any one of us if you have questions about the town. We'd be more than happy to cheer your ear off for at least an hour. Okay, seeing not a hand raised, I will let our intern go back into the corner. Okay, does anybody else have any other questions, comments before we move on? Hearing nothing else, motion?
Motion to adjourn.
Motion to adjourn. I need a second.
Second that.
Second that from Mr. Baker. I'll take a roll call vote. Dan Kane.
Dan Kane votes yes.
Kevin Baker.
Kevin Baker votes yes.
Matt Wason.
Matt Wason votes yes.
And Kevin Davis, the chair, votes yes. This concludes our June 25th meeting of the Board of Health in the town of Littleton. Thank you so much for everyone, and have a pleasant evening.